Hi, my name is Nicole Otto and I'm a semester nursing student at Lincoln University. Today is January 29th around 11:45 a.m. and today I'll be doing my chest tube video. So knock knock, do some hand hygiene. Hi, my name is Nicole, I'm gonna be your nurse today. Can you tell me your name, date of birth? Awesome. So my patient has come in and they have a tumor that makes pus that accumulates in their chest wall. So I'm gonna tell them we're gonna insert chest tube. This chest tube is going to help drain these secretions. So the doctor will come in and place this tube. There'll be an end and then this tube will be placed right here and there'll be a dressing, an airtight dressing. And then this is the drainage system. We want to make sure to keep it always flat and below. We may tape this down. And during the insertion of this, you will have some meds to ease a little bit of the pain, and we will be there to make sure your breathing is getting better and checking your vitals and everything. So a little bit about your drainage system. This section right here is the collection. This is where this will come from your chest and will collect either the blood or pus or air fluid. And each shift, a nurse will come in and mark their name, date, and time, and that's how we will see how much. If you have a big amount, we will have to call this a physician. This right here is your water seal. It's usually at 2 centimeters, and this keeps this sealed. And there may be some tidling, which is like tidals, like waves. It'll go back and forth when you breathe, when you inhale and you exhale. If there's ever any bubbling in here, this means we have an air leak in our system, so we'll have to watch for that. And if the tidling stops, we either have something going on with our system that needs further assessment, or your lung may have re-expanded and you're maybe ready to get off the chest tube. This is your suction. You can either have dry suction or some water suction, but most of them are dry and this one's dry, and you'll usually keep this around 20 or whatever the order is. While you have this, we will constantly be doing respiratory assessments, assessing your lung sound, your respiratory rate, your work of breathing, and we'll be assessing the dressing, and we will come feel around the site, and if we feel anything that feels or sounds like Rice Krispies, that's called subacute emphysema, and that just means there's some air in your tissues. We want to encourage you to keep coughing and deep breathing. This will help get the secretions out, so continue to do that. If you need to be repositioned or if you need to get up and walk, please make sure to call us because we'll have to bring the system with you. We wanted to keep it below your waist. And whenever it is ready to be taken out, when your lung has healed or re-expanded, the physician will come take this out. This usually isn't a permanent thing. It's only usually 2 to 3 days. This system we don't really empty and reuse. You always get a new one and you'll place this in the red biohazard bag. And if you feel any sudden pain or shortness of breath, please call and we'll come assess you. And